Hello and welcome. My name is Justin, and I am going to be going over the medical insurance benefit information at the University of California Riverside Extension's International Education Programs. I usually give this presentation in person, but due to COVID-19, I'm unable to do so. A few things that we'll go over first. Preventative care for COVID-19. Some things you've probably heard over the past few weeks. Just make sure to wash your hands with soap and water for at least 20 seconds. Avoid close contact with people who are sick. Stay home when you're sick. Cover your cough or sneeze with a tissue, then throw that tissue away. Clean and disinfect frequently. And then there's a couple of links to the Center for Disease Control here in the United States that you may want to just remind yourself and take a look at as you go through the program here. One question we get a lot is COVID-19 covered? All medical screening and testing for the coronavirus will be completely covered by UCR Extension's health insurance plan called Anthem Blue Cross PPO. If you test positive, coverage and expenses will be treated the same as all other illnesses. What this basically means is you won't have any really large $1,000 or $2,000 or $3,000 bill if in the unforeseen circumstance you do come down with the virus. I'm going to be moving along now to the kind of normal portion of the presentation where we talk about general things in the US, how to use the health insurance, so on and so forth. Healthcare in the United States is very different than it probably is in your country. You may have even experienced that in the few weeks or the couple of weeks that you've been here. You may need to wait 2 to 4 weeks for an appointment with a specialist. The way it works in the United States is sometimes a doctor will determine the urgency of the appointment needed and will assist in scheduling you with that help. I can do that. Sometimes the doctor's office will also assist in scheduling you with a specialist if you need to. Coverage through UCR Extension is mandatory. We cannot waive that. And it's charged at $50 per week for the duration of the program that you're in, including the breaks. Healthcare in the United States also requires a high level of patient privacy and medical information to be protected by law. That just means nurses, doctors, staff cannot talk about your medical details in front of anyone else. Keep this in mind if you're wanting to take a friend to a doctor's appointment because maybe your English isn't that great or you're not comfortable. That's fine. You'll just need to also give them permission to speak about your details in front of anyone else. Healthcare costs. Now, this is the main thing I get asked about all the time. Most healthcare in the US is privatized, meaning it's not paid for by the government. So there are some services of your health insurance you would need to pay for, regardless of if they're covered or not. We'll talk a little bit about services, just a few things that are not covered by the insurance that I typically get asked about. I'll tell you about that a little bit later in the presentation. Your insurance ID card. Looking at the insurance ID card, what you'll see here is inside of your packet or a PDF, depending on how we deliver that today, you'll see a 2020 plan snapshot handout. If you look under the section that says ID card, you'll see Anthem Mobile Health Consumer website or the Student Health mobile app website. Both of those will give you access in order to print your health insurance ID card. Now keep in mind what it says here at the bottom. It may take 2 to 3 days for your information to be placed in the computer system. We don't always know who's going to show up and who's not ahead of time. For that reason, it takes us a few days to get your information into the correct computer system. So just have a little bit of patience. If you get sick or anything is wrong in these first few days of your program, please reach out to somebody and we can show you what to do and we can possibly get you expedited and into the system faster if you're not feeling well. Another thing for the insurance ID card, you'll also see inside of your packet or through a PDF a temporary ID card if you don't have access to register your account yet. What you can do for now is write your name at the bottom of the temporary ID card, your given name, and then your family name, and take a photo of that. If you end up having to go to a doctor or a hospital or an urgent care, you can show that to the staff at the doctor's office or the hospital so that at least they know what kind of insurance you have so that they can bill that insurance, hopefully rather than billing you directly. How do I see a doctor? So a couple of things that generally required in order to see a doctor. One, we recommend you always take your student ID card. If you don't have your student ID card, which may be a possibility with everything that's going on with a lot of the staff not being available right now, take your passport or some other form of official identification. You'll need to show some kind of photo ID and proof of insurance. If you don't have proof of insurance, so if you get sick in these first couple of days and you're not sure what to do, you may be required to pay cash at the time of the appointment. If that happens, if at any appointment you do end up having to pay cash, make sure you keep all of the receipts. What we'll do is you'll keep the receipts, make sure they're detailed, and then I will work with you to submit a claim so that we can get you that cash back from the provider. In general, the easiest thing to do if you're sick during the week or if you're sick in the mornings or early afternoon is to go to the campus health center first. It's the quickest for a non-emergency. Their contact information is up here. The phone number, the address, and the hours. We'll also send you this presentation so you can look back at it. Their walk-in hours are generally 9 to 11 or 1 to 3 p.m. The location of the health center, it's not very far away. It takes maybe 10 or 15 minutes at most from the University Extension Center. So it's not a very far walk. You can also put that directly into your GPS. Or if you're living far away and you want to go to take an Uber or a Lyft or a taxi, you can also put that in for GPS directions as well. Additional information on the health center. You must arrive on or before 3:30, even if you have an appointment to see a doctor. If you cancel or you're late, you could be charged up to $20 for that late or cancellation fee. So always call ahead if possible. So one thing will happen is if you need to see a specialist, for example, if you have a problem with your knee or you've had some kind of condition that you've maybe had your whole life, and the campus health center cannot treat you, what they'll do is they'll give you a referral to see another doctor. A medical referral is a note or permission to see a specialist. If you get that, well, it says here, visit room 240 or 204 if you need assistance. When we're back in the offices, that will be true. For now, send an email either to your program advisor or to the health insurance email, and someone will set up a way for us to get you to an appointment to see a specialist. Typically, it's a little bit easier to do that in person, but it's not that big of a deal. It's something we're able to handle with you online, either via a regular video message or just a phone call. We can generally set up an appointment for you to see your specialist. So just keep in contact if you do need that. Urgent cares in the United States generally are for non-emergencies. And if it's used if the health center is closed or really, really busy. Two that you see up here, Riverside Medical Clinic and Ironstone Medical Clinic, either of those you can just go directly into. You can see they have a little bit better hours. They're open a little bit later. They're open on the weekends. So utilize urgent cares. If you're not feeling well, think you maybe have a fever, you want to be seen very quickly, and urgent care is typically the best method. Oops, skipped one there. There we go. Finding urgent cares and doctors. Utilize these pages in your packets, again, or PDFs. One is a list of all of the urgent cares that are located in the Riverside area. So if you're not feeling well and you don't know where to go, look at this list and you can go to any of those doctor's offices in the area. The other page that you see here is instructions to find a specific doctor, hospital, pharmacy, or urgent care. So for example, if you were living in a different city, maybe you are temporarily living in Fontana and you want to find a doctor or a hospital in Fontana that works with our insurance. You would utilize that list that is on the right and follow those steps in order to find a doctor that will work for you. Hospitals in the US, more for emergency care only. or very serious illnesses or extreme injuries. Think if you have like a broken bone or you're having really bad trouble breathing. Things like that are typically where we would go to the emergency room at. With our insurance, you can go to any hospital, you can go to any emergency room. Just make sure that it is a true emergency because hospitals tend to have a little bit higher cost and they tend to be longer wait times at the emergency room. You can see here I mentioned life-threatening, extreme illness, injury. Calling 911, call if there is a life-threatening emergency, either to yourself or someone else. You'll need to give your name, location, and describe the situation. If you're on campus, let the operator know. Never call 911 to get a ride. It is illegal and it can be very, very expensive. Again, how much will it cost? We touched on this a little bit earlier. At the campus health center, it's covered at 100% for most services. So most services means things like you're not feeling well because you have a headache or a throat ache or a stomach ache, or you have something that you just want to be seen for that's been giving you pain. Most things will be covered by the health center. Most things are also covered at referral doctors. So a referral doctor, if you remember, that's the specialist in order to get special treatment for maybe a condition you've had your whole life or something that's recently come up that the health center is unable to help you with. If you look down at the chart, you'll see urgent cares versus hospitals. The one thing I want you to notice is the copay. So for the copay, you'll see at urgent care, most of the time it will be $0 versus hospital is $75. So if you go to a hospital, the amount you'll pay to go in is $75, whereas at an urgent care, it's $0. Obviously, if you need to go to a hospital, please go. Go to a hospital, go to an emergency room if it's a medically necessary thing. But if you're just not feeling a little bit okay, try the urgent care first because in general, that will be cheaper. A deductible is a very American thing. So it's the amount you pay for covered services before your insurance begins to pay. So if you go to the health center or you receive a referral, you don't pay any deductible. But if you go directly to a doctor's office, if you set up an appointment on your own, there is an annual deductible of $100. So that's the amount the insurance requires you to pay before the insurance will begin to cover additional treatment for covered services. So if you want to see a doctor because you have a neck problem and you don't want to go to the health center first or you don't have time to, that's okay. It's just you may have to pay that $100 deductible towards the amount that the doctor charges before the insurance will begin to pay. It can be a little bit confusing. I understand if you're a little confused right now. Just keep in mind if you have any questions regarding appointments or setting things up, you can always call and ask me or we can set up some kind of video chat meeting to talk about that first. So I mentioned earlier, the insurance covers most things, but it doesn't cover everything. So what are examples of items not covered? Dental and vision are probably the two biggest things I get asked about. Dental services, unless it's an emergency. So if you hurt your mouth somewhere, that may be covered. But if you just want like a routine cleaning, if you have a root canal, if you have a wisdom teeth, things like that, they will not cover. Vision is limited to one exam per year, one eye exam, and they also don't cover things like prescription lenses and frames and things of that nature. Hearing exams, hearing aids, and other hearing treatments are not covered, nor is cosmetic treatment, blood typing, some vaccinations, and acne. With vaccinations, you'll always want to ask first. The HPV vaccine is covered if you're 26 years old or younger. If you receive treatment from the health center for an item not covered by the plan, you would be responsible for paying the fees there. So just keep that in mind as you go in for different treatments. Pharmacies and prescriptions. You must use an outside pharmacy that's not the campus pharmacy. That's just a general rule of the health center because they have so many students. They ask that our students use a different pharmacy. That doesn't mean you have any higher cost or anything like that. It's just they require you to use a different one so that they can keep the traffic down. So any of these stores you see, Walmart, Rite Aid, Costco, Walgreens, CVS, Save-On, any of those, you'll find those locations everywhere. And they are all pharmacies that you can utilize with our insurance. So the copay, meaning the amount you pay at the pharmacy, is generally $10 to $50. From what I see from dealing with students all the time, it usually comes out to the $10 amount as opposed to the $50 amount. But of course, there are many different conditions, many different things that could happen. So just keep that in mind. But in general, if you're getting a prescription, it shouldn't be more than $10, maybe $15 to get that filled. Over-the-counter medication is a big recommendation of mine. Many medications are available in the US without a prescription. So if you have a small medical problem, stomach ache, headache, sore throat, be sure to ask a pharmacist that's working during the day for an available over-the-counter medication until you're able to see a doctor. Of course, if you're running a fever, if you have a really bad cough, and especially now during the time of COVID-19 and the coronavirus spreading, there's a lot of fear and uneasiness going on. So if you're just not sure, it's fine to go to a doctor or an urgent care. We encourage you to. We encourage you to stay home. But if you're just feeling like it's not very serious, it's a much smaller problem, then utilize the over-the-counter medications, buy medication yourself, and just stay home for a couple of days and see if you start to feel better. Extra coverage is really not necessary. It doesn't benefit you a lot with students in our program, so I'm going to skip over that. If you have any questions, my phone number is 951-827-1706. I have 2 email addresses I can be reached at. And when I'm back in the office, I will get to see your lovely faces, and you will get to see mine in room 240. But for now, we'll be doing most things either online, through email, through phone. Like I said, if you have specific questions or concerns, we can always set up a video chat and talk individually. One thing that happens with health insurance and the medical benefits and going to the doctors and understanding the system is I'm able to answer a lot of your questions more clearly when I know exactly what it is you're asking. So typically what will happen is you'll have an incident or something will occur, you'll go to a doctor, and then you'll have the questions. So we keep the orientation and the general information just that. We keep it general. And then when you have questions and concerns and want to set things up, that's when we talk on a more individual one-on-one basis. But just know that I am here for you. If you're experiencing any symptoms of the coronavirus or anything else that could happen while you're here during your time in the United States, please feel free to reach out to me. I want you to feel like you have the exact same level of care, oversight, and just general support that you would if we were in the offices. So with that, that concludes the presentation here. And I wish you guys the best. Stay safe, stay healthy, and enjoy your time here at UCR Extension and Riverside, California. Thank you.